In reconstruction, there are several considerations. One is timing. When should it be performed? In most women who have relatively early cancer diagnosis or pre-invasive cancer, we can do an immediate breast reconstruction. So at the time of mastectomy, we can get the reconstructive process rolling. In some patients, however, due to their own medical conditions or the state of the cancer, we need to wait, and so that's a delayed reconstruction. In either case, we can make a nice breast form, and it's simply a matter of choosing the appropriate time for the appropriate patient. With regard to the technique for reconstruction, we're essentially trying to create a breast mound to restore the shape and appearance of the breast. That can be either an implant-based breast mound or one that uses the patient's own tissues. With an implant-based reconstruction, we'll usually begin with a device called a tissue expander. This is a special saline implant that has a port that we can access to instill additional volume and stretch out the skin overlying the expander. This creates a pocket in which we'll place a definitive implant. At the time of surgery, the breast is removed, that's the mastectomy, and we'll put this below the chest muscle, the pec muscle, and sew everything up. The patient then returns to clinic in about a month or so, and we begin the process of expansion. Through the skin, we can access this port with a small needle and instill fluid. In doing so, we stretch out the skin and create the pocket for the silicone or saline implant that will ultimately create the breast mound. And my hope is that in doing so, that they're able to see beyond the reconstructive process and to see that there is a future in which they can feel attractive and they can have the relationships that they want to have with confidence.